Hello, I'm Dr. Sadika. I'm one of the junior doctors here at this pediatric department. May I know your name, please?
Yes, of course, Doctor. My name is Sarah Smith. Is my son okay? I haven't seen him right now.
Yes, Sarah. I'll tell you about your son in a minute. But let me confirm name and age of your son, please, if you don't mind.
Oh, okay, sure. My son name is Adam, and he is 4 months old.
Thank you, Sarah, for confirming the name and age of your son. Sarah, yes, your son is under observation and we are taking care of him. Before I provide you more information regarding your son, could I ask you a couple of questions? What really happened, if you don't mind?
Okay, sure.
Sarah, according to my notes, I can see that you brought your son with some swelling on his arm. Is that right?
Yes. Well, basically, I came home from my night shift. As
Mm-hmm.
I work as a nurse, you know how busy the nurse is. And when I reached home, he was crying a lot. And I noticed that there's a swelling, and I brought him immediately to the hospital.
Yes, Sarah, you did a very right thing, Sarah. Uh, Sarah, could I ask you a couple of more questions? Like, what was your son doing when you reached home? Like,
He
how
was
was he?
crying. He was
Oh,
just crying.
okay. I'm so sorry, Sarah. Sarah, who was the main carer with him when you were away?
My boyfriend.
Okay, I can understand. Mm, Sarah, uh, is this swelling happened for the first time, or is there a similar thing happened in the past as well?
No, the swelling happened for the first time.
Mhm. Is this your only child, or do you have any more children?
No, this is my only child.
Okay, Sarah, thank you for that. Sarah, now I'm gonna ask you a couple of questions regarding your baby. Uh, as I can see, he's 4 months old. Could you bit describe about like how was his birth and how was his general well-being since he was born?
Well, he's all right when he was born. It was a term,
Mm-hmm.
and
Good.
also it was a vaginal delivery.
Okay. So was he okay after birth? Did he require any special care or anything?
No, no, he wasn't.
Mm-hmm. That's good. Uh, Eating wise, is he breastfed or bottle fed?
He was breastfed.
Mm-hmm. That's good. And is he up to date with his jabs?
Yes, he is.
Okay, that's
Are
good.
you all right?
And uh, I'm gonna ask you a couple of questions regarding his development, Sarah. Does he smile back when you smile at him?
Well, he's 4 months old, so I couldn't catch his smile really yet.
Mm-hmm. Okay. So does he have neck holding?
Yes, yes, he does, and he
That's
also
good.
look at me a lot. Yeah.
Oh, that's good. That's good to hear that. Sarah, how about his poo and his peeing? Is everything okay?
Yes, yes, is
Are you
everything
happy with
fine?
it?
Yes.
Okay. Okay. So, does he have any other complaints other than this arm swelling? Maybe any cough or fever or any rashes in the body?
Well, right now there's no rush at all. Everything is fine.
Mm-hmm. So, apart from this arm swelling, you mean you don't have any other concern?
Yes, I don't have it. Is he all right? I'm really worried. I want to see him.
Yes, Sarah, we will let you see him because he is under observation and our other doctors are taking care of him. So while
Okay.
I'm here talking to you, so your baby is comfortable there. So once we finish the chat, I'll ask my seniors like whether they can arrange an meeting with your child. Okay?
Okay.
Yeah. And yeah. Sarah, does he have any? Is he on any medication? Maybe for like
No, no, he's not on anything.
not on any medication. Okay, that's good.
No.
Any similar thing in your family members, like your paternal, your side or your husband's side, your partner's side?
No, no,
No?
no, no, that's everything is fine. Yes.
Okay, that's good. Sarah, after I had a chat with my doctors, like who are looking after your baby, what we suspect here is something not very happy. We think there is something wrong going on, and I don't know whether your child fell down or what happened, but unfortunately we have done a couple of tests on your child, and after the x-ray we got to know that your child has sustained a fracture. I'm really sorry to tell you that.
Sustained fracture. This is it. What you say?
Yes,
Okay. So how did it happen?
that's what, Sarah, I'm not sure at the moment. We need to investigate in that thing. uh, if I mean, I can, as you said, you were away for work, so I need to ask a couple of questions to your partner as well. Or if it's better, you can have a little chat with him so that he can better tell you like what happened exactly. Yeah.
Okay. Okay. Sure.
So
So what do you want to ask?
unfortunately, sorry.
What do you want to ask about my boyfriend?
Uh, how was he? Like, is he getting along okay with the child, or is he the biological father?
He is not a biological father.
Okay, I can see that. But I'm not quite sure, Sarah. Like I'm not blaming anybody, but we are still in. We need to investigate. So looking at the injury, it's not a simple injury that a child of 4 month old could sustain. So we suspect something sinister here. Do you get me?
I are you are you accusing us? Do you think my boyfriend does it? Are you
No,
accusing
Sarah.
us?
I'm sorry. Like I'm not trying to say that maybe your boyfriend did it, but something it doesn't sound right to us. Like a child of 4 month old could not sustain such an injury because the kind of fracture is a spiral fracture that doesn't normally happen if a child like falls from a couch or something, but it needs a great force, like some twisting kind of force.
Well, doctor, I don't know what should I say, but my boyfriend had a really rough night last night. As he recently lost his job, and things everything's going on in his head right now, maybe, and I don't know what
I,
happened.
I can understand, Sarah. We all go through different difficult times, and I'm not saying that could be one of the possibility. I'm not saying like this might have happened, but that could be one of the possibility. Unless we talk to him and get everything clarified, I can't say anything more. Yeah, we are taking care of your child, and he is in our best hands, and we will do all the possible things to keep him safe.
Okay.
And I'm sorry to say that we will not let your child go home with you at like as we are treating his fracture. Even after he gets better, we are not going to send the child with you. I'm really sorry about that. And we
Are
need
you
to
taking
inform.
away my child? Are you taking away my child? What are you saying? I cannot even see my child anymore. But what is it?
You
What is
can
it going on?
you can see him, Sarah. You can see him, you can talk to him, you can hold him, but the only thing is we have our protocols we need to follow in such kind of in such situations. What we're going to do is we will inform the social services, Sarah.
Oh, the
So the
time is up.
social services, they're gonna